So as we know, heart disease still remains the number one killer of both men and women worldwide. And for decades, we as physicians, we've mainly been focusing on things like diet, exercise, and really focusing on your physical health in regards to prevention. But there's still a piece of the puzzle that I think is not really well understood, and that's the mind-heart connection. So understanding how your mental health can directly affect your cardiovascular health can unlock the next level of longevity, your overall well-being, and attaining optimal mental and heart health. In this session, you will learn first what the mind-heart connection is. Then we'll discuss how mental health disorders can directly cause cardiac symptoms. Next, we will learn how to avoid misdiagnosis. So how can we tell if this is your mind or your heart? Then we will understand the differences of heart disease, which can be life-saving. And lastly, I will go through a cardiac checklist that will jumpstart your journey towards a more heart-healthy lifestyle. So if you look at the symptoms comparing mental health as well as cardiovascular disease, they can be very similar. And so it's very easy to see how patients can be caught in this vicious cycle of seeing multiple doctors, having unnecessary tests, and feeling very frustrated that the underlying issue has not been identified. And so understanding this mind-heart connection can empower you to not only be an advocate for yourself, but to be an active participant in your medical care. My name is Dr. George Adesina. I'm a general adult cardiologist here in Houston, Texas. I've been a practicing cardiologist since 2017. I love everything about cardiology. I can treat cardiology every day, but one of my biggest passions is actually teaching patients how to prevent cardiovascular disease. First way for us to understand the mind-heart connection is understanding what the two organs do. So I think if you ask the general person, what's the most important organ of the body, they're either going to say the mind or the heart. The mind for sure is the command center, right? So it's the thing that's going to help us understand our emotions, our personality, how we're feeling, the essence of who we are. But the heart and the cardiovascular system actually works to deliver nutrient and oxygen-rich blood to every single cell of your body. So nothing in the body can survive without the heart. So of course, as a cardiologist, I'm biased thinking that the heart is the most important organ of the body. I think when most people think about the mind-heart connection, they think of how our emotions and how our stress is affecting our cardiovascular health. But this is actually a two-way street. So communication between the two is actually bi-directional. Not only are they connected through blood flow, but they're actually connected through a nervous system as well. And so this can affect our heart rates, our blood pressure, our emotions, and even our cognition. So there's a couple of examples that really illustrate well this mind-heart connection. The most common, and I think probably the most fascinating, would be Takotsubo cardiomyopathy. That's also known as stress-induced cardiomyopathy, but that's better known as broken heart syndrome. This condition is directly linked with stress, and it disproportionately affects women. We usually see it after a traumatic event, so usually extreme fear or anger, or what we commonly saw after the pandemic was grief. So those feelings that you feel after you're losing a close family member or friend. And what happens is when you're in that very stressful time period, your body releases a surge of stress hormones like adrenaline. And those can actually trigger a cascade of events that can mimic not only a heart attack, but also congestive heart failure. And so I see these patients all the time where they come in with chest pain, shortness of breath, palpitations, dizziness. They have all of the lab findings of someone who's having a heart attack. Their EKG looks like they're having a heart attack. And if we get an ultrasound of their heart, it looks like they're in congestive heart failure. But when we do further tests, we find no heart blockages at all. And again, once we take a better step back and look at the overall picture, we can usually pinpoint some type of stressful event that triggered this cascade. Another disorder, I think, is also something that we call coronary vasospasms that are also known as transmental angina. This, again, is linked directly with stress, disproportionately affects women, and it can cause chest pain, chronic chest pain that usually occurs at night, at rest, and a lot of times it wakes people up in the middle of the night with this pain. They think they're having a heart attack. Just like broken heart syndrome, there was no sign, no evidence at all of any heart blockages. Luckily, both of these conditions can be treated with medications, but again, the cornerstone of this is treating that underlying stressful triggering event and making sure your mental health is in check, as it can cause these symptoms, these disorders to get worse. It's actually fairly normal to have elevated heart rates or elevated blood pressure when you're in a period of stress. That's normal. That's actually how our bodies are programmed to respond. But if you have anxiety and you're having the system elevated throughout the day multiple times for a long period of time, it changes how your body actually responds to stress. And that's where the damage comes. That elevated heart rate, that elevated blood pressure, that's putting undue pressure and stress on your heart, on your blood vessels, and that's what can cause that damage in the end. And so I've had patients come into my office with blood pressures in the 200s, and they're walking around, they're functioning, they have no symptoms at all. One of the things that we get worried about, though, is even though you feel fine, exposing your arteries to that recurrent elevated pressure, it causes small damage repeatedly. And so if that damage is occurring in your brain, when you destroy those arteries in the brain, it can cause a stroke. You can have damage to the small arteries of your eyes that can cause blindness. To your heart, it can decrease the heart's pumping capacity and cause heart failure. In the legs, it can cause decreased circulation. And so even though you feel fine, you're having this micro damage throughout this time period. I think one of the biggest examples is your kidneys. And so if you go into a dialysis center, most people who have end-stage kidney disease, it's either from having uncontrolled diabetes, and for the most part, it's elevated blood pressure. Because again, having that repeated damage to those kidney arteries, it causes the kidney not to work efficiently.
So what do you do if you're experiencing heart health concerns? The first step should be one, seeking medical attention. When you're seeing a physician or you're at the ER or in urgent care, those providers will evaluate your symptoms and determine what tests need to be done. Things like a chest x-ray, echocardiograms, and EKGs will allow us to assess whether the cardiovascular disease is present. If you test positive for heart disease, the next step is working with your cardiologist and a heart team to really focus in on what's going on and also try to prevent any further damage to the heart. If your tests are negative, the buck does not stop there. The next step should be talking to either your primary care provider or talking to a mental health professional to make sure that your mental health is in check, as those symptoms can be very similar. So seeking the necessary help to make sure that you're having lifestyle changes to improve and support your mental health.